My name is Aishah, and I'm a second-year PhD student at Warwick Medical School. I'm especially passionate about global women's health, improving health and well-being of women and girls worldwide, with a particular focus on those on the margins of society. This involves recognizing wider determinants of health and addressing health disparities and inequities. Using an intersectional approach, my PhD project revolves around exploring the pandemic experiences of women in the informal economy and their perspectives on crisis preparedness to identify their needs and inform a more equitable future pandemic response. Today, I would like to talk about evidence synthesis. Evidence synthesis is a method or process of bringing together findings from multiple studies from a range of sources and disciplines to draw more comprehensive conclusions about a research question. It involves systematically identifying and collating relevant evidence from existing studies that meets pre-specified eligibility criteria to provide an overall summary of current knowledge. This method is helpful for informing and supporting practice, decision or policy making, as it is carried out in an unbiased, reproducible way. As part of my PhD project, I conducted a qualitative systematic review, synthesizing the health and well-being experiences of women working in the informal economy during the recent pandemic. I took a holistic view of health and well-being, drawing from models of health determinants. I was interested in not only physical and mental health, but also the conditions which influence health outcomes, such as economic and social factors, access to health and social care, as well as health behaviors. In doing so, I tried to provide insights into the needs of women informal workers, many of whom have been struggling before the pandemic, and to present snapshots of their capacities and resources to foster a strength-based approach to their health and well-being. This involves drawing together evidence from studies, utilizing qualitative methods for data collection, such as interviews, focus group discussion, or ethnography. I have privileged the knowledge within qualitative data, as factors relevant to the experiences of these women may not have been demonstrated by statistical analysis, and also to center the voices of those experiencing multiple axes of disadvantages. Conducting an evidence synthesis typically requires a team. We need multiple reviewers to independently screen, select and assess studies, to reduce the risk of bias and increase the credibility of findings, and to enhance the rigor of research. I have been fortunate to have had the opportunity to be involved in several evidence synthesis studies and hence have experiences working in multiple teams. My experiences have been mostly positive so far. Dividing tasks among team members reduces the workload and can speed up the research process, and having teams composed of individuals from different disciplines and expertise allow for a more diverse and nuanced understanding of the evidence. There could be challenges, however, related to communication issues, conflict resolution, and evidence synthesis can require a significant investment of time and effort. So it is important to have clear research protocol and effective communication and coordination skills to manage expectation and maintain cohesion within the team in order to ensure that the study progresses smoothly. While I was conducting the systematic review as part of my PhD project, I was also concurrently working on preparing for the second part of the project, which is a field study focusing on the impact of the pandemic response among women working in the informal economy in Malaysia. I carried out some public engagement activities to gauge awareness of the topic and to seek feedback on the participant-facing materials that I have prepared. I spoke to public contributors about the systematic review that I have done to provide context, and one of them suggested that I could use artwork to illustrate my research findings, to add visual appeal, and to communicate the research to a wider audience. This public contributor was artistically gifted, and she helped me in drawing some of the themes that I have captured in the evidence synthesis. I have used this artwork in my research poster and presentation. It was something that I did not think of before, but I was pleasantly surprised with the idea. I am aware that my own background, experiences, and perspectives can have an impact on all aspects of the research process, including the research question, design, and reporting of the results. For example, with my medical background, I may be more likely to identify and include studies from that field and potentially overlook relevant studies from other perspectives. Coming from a rather privileged background may also affect the assumptions I make about the experiences of marginalized communities and my interpretation of the research findings. I myself have also previously worked in the informal economy with minimal social protection, so having this insider or rather in-betweener experiences enable me to resonate and recognize things the way women informal workers do. I have to address my own personal identity and positionality by reflexivity, so continually reflecting on my underlying bias and assumptions, keeping a note about the decisions I made during the research process, and discussing with other members of the multidisciplinary team to seek their viewpoints. I would recommend that anyone interested in evidence synthesis first familiarize themselves with the steps of this method by thoroughly reading and examining evidence synthesis studies in academic journals. They should also work on literature searching skills, so working on using research databases effectively, developing the search strategy using appropriate keywords and operators, and also how to manage the search results using bibliographic software. And last but not least, since they will be working in a team, they could explore tools such as Ryan or Covidence to streamline the collaboration process. There is a lot of resources online, and they can also consult the librarian or information specialist for expert guidance. Thank you for listening to me talk about evidence synthesis. If you would like to learn more, please get in touch.